How did nursing in the military different from nursing in the civilian world?
Um, One of the ways that it's different is there's a lot more structure in the leadership, um, and because of that, I think things sometimes go more smoothly because there is that chain of command that you have to go up to. It's also different because depending on where you're stationed, you can be nursing, you can provide nursing care to a really specific um, population, not like when you're out in the real world where you have um, all kinds of populations coming in. If you're stationed on a military post, you might see a lot of different kinds of patients. But if you're stationed on an airfield or in a national during a time of war, then you see just usually just war injuries and stuff.
Do you have different types of military nursing, like ER, surgical, nurse, etc.?
Yes, they do. In fact, the Army has a really great training program for specialty kind of nursing. Once you've been in the Army for a couple of years, once you receive your degree and you practice for a couple of years, you often get the opportunity to go to specialty schools, not like getting a master's degree, but specialty schools for maternal child health care or ER nursing or trauma nursing, surgical nursing. There's a lot of specialty schools that you can go to. And then the Army also has, they do have programs for master's level and doctoral level programs. They have a great advanced practice degree nursing programs.
Do you think Army nurses are more prepared?
Uh, Depends on what kind of prepared you're talking about.
For like emergency response?
Yes, because that's a great deal of their training. But most Army nurses go to civilian nursing schools, so they don't have really any kind of different training. After they get into the service, and they receive different training, that they're differently prepared.
Um, is the income more or less or about the same for military nurses?
I don't know anymore. It's been a long time since I've been in. I think that they probably get more benefits. Their benefit package is different because they automatically get health care and dental care, and they get money for housing and stuff like that. And there's a lot of benefits that they don't have to pay out of pocket for, but I don't know if they get paid any more than civilian nurses do. They have a greater opportunity, I think, for advancement through the ranks because they have a rank system.
Were there any different classes for students that wanted to be military nurses?
Oh yeah, you had to do, but these weren't associated necessarily with regular nursing training, getting your BSN. These were associated with when you went to your unit and the different classes that you had to take just because you're in the military. If you join the Army after you finish your degree, then you go through officer basic training and some, which is kind of like basic training where you learn how to shoot a weapon and stuff about combat and that kind of stuff. But that all comes after your civilian training.
If you could go back, would you have stayed in the Army and became a nurse, or would you have just gone through college and got your nursing degree that way?
Well,
like, what were the benefits for being an Army nurse instead of just going through school?
well, remember, I came through it very differently. I went into the Army as an LPN, and then when I got out, I joined the reserves. When I came off active duty, I joined the reserves, and I went back and got my ADN and BSN, and on and on. I can't seem to stop going to school. But I think that if I had had if I had a straighter line in my life as opposed to all the curves I took, then I think I probably would have stayed in the Army until I retired.
That's it.
Thank you.
Thanks, Mom.